course, we're meeting today on the occasion of the World Mental Health Day. And in that, let me start by asking our first question on Slido. So if you could use this QR code or go to slido.com, the first question we want to know is, where are you? Where are you joining us from? So you'll be able to see in a minute, on the Slido, you'll have an opportunity to put in your country. Ideally, let's start with your country or your city, and this will give us an image of where you're from. So I'll leave that open for a few seconds so people can write down, where are you joining us from? Where is this virtual community reaching out to? That's the joy of having gone virtual. We're no longer limited by the people who can get to us, who can fit into a room. So maybe there's people watching from different time zones from all around the world, and we just love to know who's out there and who's watching us now. Okay, I can start to see that we're having, so far, it's all from Europe who's joining us. Welcome to the Netherlands, the Czech Republic, to Denmark, Germany, Lithuania, Austria, France, Italy, the Netherlands. Finland has joined us. Welcome, good morning. Dublin, Ireland. Scotland, Austria, yes. Great. So you can see that people are joining us from all across Europe. Switzerland has joined us as well. We have a big contingent in Finland. Good morning up north. Spain has joined us. Excellent. Luxembourg is also here. I'll just give it a few more seconds to allow the last people to log in and tell us their country so we can see the map. But I'm just looking at this and I can see that we're reaching across Europe, from Spain on one side to Finland in the north. Croatia has joined us. Welcome. So we're also, Norway has joined us. We're also present in Central and Eastern Europe. Excellent. So I think I'm going to stop that poll. We've had 40 votes, 42 so far. Let's close this. And now that we know roughly where you're contacting us from and where you're physically sitting, now we want to ask you a question that probably everyone should be asking themselves on World Mental Health Day. How are you feeling right now? Just in one word, how are you feeling? How are you doing? It's been a challenging year. People's experience have been very different. We know that people have had some very challenging, sometimes traumatic experiences. They've also had opportunities to connect again in different ways. So how are you feeling right now? Feeling well, good. Bit nervous, that's honest. Energized, great, that's what we need on the morning of a Friday morning. Excited, yeah. Good. Tired, I know that feeling. Interested, yes. Optimistic and hopeful, great. Panicky, yeah. Anxious, okay. Curious, yes, me too. Let's see what magic comes from all the different voices and panels that we bring together. But it makes sense on World Mental Health Day to start by checking in with everyone to say, how are you doing? We often don't do that enough, to just check that we're all doing okay. Someone's feeling balanced, yeah. Starting to wake up, good. I hope we'll give you inspiration and make you feel even more energized. Moody, fair enough. Fed up, everyone has days like that. What we wanted to do was allow everyone to acknowledge and validate everyone's feelings in whatever position they are, however you're feeling, it's okay. Tired, good, okay. Happy, excited to attend, yes. I hope so. We might ask you at the end as well to see how you're feeling at the end, and hopefully people will have felt like they've learned something, they've been inspired, they're energized. Somebody's feeling Friday. Yeah, sometimes days can have a whole feeling, aren't they? There's definitely a Monday feeling, a Friday feeling. Great. So far, 42 people have commented. I'll leave that open for another few seconds to see if anyone else wants to share with us how you're doing. This is just a little snapshot of how people are feeling all across Europe. We've got people tuning in to watch us, and here's how people are feeling. Great. Calm. Balanced. Okay. Tired is still right at the center of the picture. Still a lot of people feeling tired. That might be tired just for the day because of however you pass the night. Tired because we're just about to enter the winter season, shorter days. It's been a long period, challenging to deal with COVID and all the restrictions and everything else, the uncertainty. But also people feeling energized and ready, some hopeful, calm. Good. Okay, I've had 46 votes so far, so I think we'll close that. And now we're going to ask you the third question. And now we want to know, what do you hope to get out of today's event? What are your expectations? If we just asked you how you're feeling now, how do you hope you might feel at the end of our event? When hopefully we've given you food for thought, ideas, inspiration, background information. What do you hope to get out of today's event? You want to learn a lot? I hope so too. That's the reason we all come together, is to share our ideas, to be inspired. Up-to-date perspectives. Great. Some implementable solutions. Yeah, an overview of the situation. Idea exchanges, getting inspired, yeah. Knowledge, inspiration coming through a few times. This is a message to the speakers who are coming after me, by the way. People are looking for you for inspiration. Knowledge about rights, well, certainly you should be able to hear some of that today. Implementable solutions and learning. We're asking you this question now because hope, somebody wants to get some hope, good. When I work with speakers before an event begins, I ask them, how do you want participants to feel when you finish speaking? And very often, speakers haven't planned to think about this. So this is an opportunity for speakers coming later today. Here's what people want: innovation, inspiration, a bit more information about their knowledge of the rights, particularly in a changing digital age, better understanding of the field. They want inspiration, they want hope, and acknowledgement of the mental health impact of COVID and some implications for the future of Europe. Steal some ideas. That's a very honest one. On that idea, question of stealing some ideas, let me tell you the story of the magpie. Magpies and robins. Those are two birds. Robin is a little bird that you see in winter that's got a red chest. It's very often used on Christmas cards. And the other bird, a magpie, is a bird with a long black and white tail. You find it across Europe. Now, robins are solitary birds. They're quite aggressive. If you put a plastic robin in a tree where there is a real robin, it will go and attack it. It defends its territory. It's very solitary. Whereas magpies are social birds. They will even kind of come together and group parent. And if you've ever heard magpies, they chat a lot. Now, what this means is that knowledge is shared. So in England, they used to deliver bottles of milk to the doorstep. And that used to be in a tall glass bottle. And cream rises to the top of the milk. So, of course, it was a ready source of nutrition for birds bringing up young babies in their families. So to stop the birds pecking at it, they introduced a thin aluminium cover on the top of the bottles of milk. Now, one magpie somewhere worked out that you could peck your way through this seemingly impassable barrier of metal. And because magpies are social creatures and they share information, within a few years, this behaviour of pecking through the metal top spread all around the UK. But because robins are solitary birds, that information didn't pass. So that behaviour did not move beyond it. So this idea that somebody said they wanted to steal some ideas, brilliant. That's exactly what we want you to do. Be magpies. Anything that you hear that inspires you, that challenges you, you think that's implementable, I could use that myself, be magpies. So people are wanting, acknowledging cultural differences.
Hi, everybody. We seem to have temporarily lost Tamzin, but I therefore suggest that we move on. I am Claudia Marinetti. I'm Director of Mental Health Europe, but we would like now to hear from Jan Berntsen, who is the President of Mental Health Europe.
Okay. Dear participants, dear listeners, hello, good morning, everyone. So I'll start my video. Okay. As the President of Mental Health Europe, it's my pleasure to welcome you to this important and timely event discussing the future of mental health, rights and recovery in Europe. I think it's not an exaggeration for me to say 2020 will become a central year in collective memory. The world continues to grapple with the outbreak of the COVID-19 pandemic, and every day we are accompanied with news of updated numbers of infections and changing governmental efforts to combat the outbreak. Beyond its meaning as a sanitary measure, social distancing has become a term of fashion. But I would like to say I personally prefer physical distancing over social distancing. Why? Because this pandemic is also a challenge to all of us, as we are confronted with questions that we would not have imagined a few months ago. For example, when can the children see their grandparents again? Is it safe to perform indoor sports? How should I celebrate my next birthday? These times are often more than a reflection on how to maintain our physical health, but challenge our fundamental ways of living together, maintaining our social ties, and supporting each other. Speaking of birthday, in this turbulent year, Mental Health Europe is marking its 35th anniversary. Let me say that today's conference adds to an exciting list of events Mental Health Europe organized over the years. Following the end of the Soviet Union, Mental Health Europe was instrumental for mental health reforms in Eastern and Central Europe. In May 1991, Václav Havel, then President of the Czech Republic, joined our conference in Prague. In 1994, we established another important conference in Belfast, Northern Ireland, addressing the theme of conflict and mental health. In August 1995, Mental Health Europe hosted a conference in Dublin called Time for Reflection, with more than 1,600 delegates from 69 countries, including ex-US President Jimmy Carter and Mary Robinson, then President of Ireland. Over the last day, I was looking at the title of today's conference. I guess again, we could call it a good time for reflection when we talk about the future of mental health, rights and recovery in Europe. I believe you would agree with me in saying that big challenges are affecting our future. First, because it's just all encompassing the COVID-19 pandemic will continue to leave its marks beyond the moment of the vaccinations. I believe there is no doubt in saying that many fear the economic consequences, maybe losing their jobs or homes. Children and students might be able to go back to school and university now, but an entire generation is confronted with questions of their future, knowing that the world will never be the same as it was before the pandemic. It also makes us think about people living in institutions, older persons in care homes, and persons with disabilities. Maybe this pandemic can also be an opportunity to question our system of care, with the future lying outside the institution and in the community. Beyond the pandemic and its consequences, I do not want to forget the situation of many migrants and refugees and the challenges they face when they are arriving to Europe, with serious implications to their physical and mental health. And last but not least, beyond the COVID pandemic, the effects of climate change are looming, fundamentally disrupting our planet and ways of living. In these and many more challenges, there lie questions around mental health. They show that prevention and recovery in mental health are not single issues, but span across the sectors. For example, we are just beginning to understand the links between the climate change and mental health. But for us, as Mental Health Europe, it already is clear when working with persons experiencing mental ill health, the pandemic is increasing existing vulnerabilities affecting some people in our societies more than others. At this point, let me bring the vision of inclusion and exclusive societies, which we can only achieve if we carefully look at how the pandemic affected persons with mental health problems and how we can make smart investment to combat exclusion. Going back to the conference title, let me continue with looking at the future of rights in mental health. As a promising and positive sign, the last years saw an increase of talking in human rights with mental health. This is mainly thanks to the emergence of the United Nations Convention on the Rights of Persons with Disabilities, which was ratified by all EU member states and the EU itself. The UN CRPD has central implications for persons with psychosocial disabilities and people experiencing mental health problems. And yet, there is a long way to go. Despite promising practices of support and decision-making, we see that all the EU countries still maintain some kind of guardianship regimes, as a recent report by Mental Health Europe shows. Next to legal capacity, the UN CRPD calls states and societies to end coercive measures challenging existing practice of psychiatry until today. And as I mentioned before, the future of mental health lies in the community, not in the institution. To achieve such change, users and survivor movements need to be at the core of decision-making. And finally, there is mental health and recovery. The COVID pandemic will keep us busy for a while. Beyond concerns around our physical health, it continues to challenge our mental health and well-being. Staying indoors and out of isolation can be easier for some and harder for others. Thus, 2020 is an opportunity to make smart and thoughtful investments today for a better future with good mental health for European societies tomorrow. The European Union and its member states can and should be key drivers for investing and pushing forward mental health systems that take into account the challenges we are facing. Investing into mental health is not an act of luxury, but it's necessary action to establish healthy societies, since we all know that there is no health without mental health. And in order to make that happen, we, as Mental Health Europe, are building partnerships with the EU institutions, the European Commission, the European Parliament, and national governments, but also with the World Health Organization. Clearly, our collaboration becomes stronger and more impactful. I hope this will continue in the future. A final thought exercise. Let us imagine 15 years from now. That would be 2035. Mental Health Europe will then celebrate its 50th anniversary. And hopefully the corona pandemic will have become an historical event. However, the coming page of history are still blank. How we write the future of mental health is entirely up to us. As we all know, conferences are only possible thanks to the passionate and dedicated workers behind the scenes. Let me conclude with thanking everyone who made this conference happen, in particularly the team of Mental Health Europe and all the panel participants and their assistants. Now, I'm looking forward to the exchange at today's conference with two exciting panels, discussions, and I wish you all a great day and a good internet connection. Thank you very much.
Thank you, Jan. And apologies for the technical problems that pushed me off earlier. I'd like to now pass the floor to our next speaker, Paul de Bock from the Belgian Federal Public Health Service, the head of Department for Psychosocial Healthcare here in Belgium. Paul, the floor is yours.
Thank you very much. On my turn, I would like to welcome you to the conference about the future of mental health, rights and recovery in Europe that is being organized by Mental Health Europe. Normally, the event would take place in the buildings of the Federal Public Service, Health, Food Chain Safety and Environment in Brussels. But the global crisis has made it necessary for this meeting to take place online. First of all, I must apologize to our Director General, Mr. Pedro Facon, who should have addressed you this morning, but who has had to cancel because of his role in fighting the corona crisis. So you have to do it with me. It is the same corona crisis that confronts us with the consequences for the psychological well-being of the population when security measures put a brake on social contacts that people maintain under normal circumstances. Here too, we note that people who do not feel good about themselves are reluctant to seek help or wait a very long time to seek help, often when the complaints have become seriously. This observation argues for more effort on low threshold access to mental health care in primary care. Of course, in many cases, the GP is the first care provider who is approached for this. We often notice, however, that they opt for a drug treatment, which is why in Belgium we have chosen to invest in an easier access to specialized mental health care through primary care psychologists. Users can call on the services of a clinical psychologist at a very advantageous rate, who, during a maximum of 8 sessions, is responsible for assessing an indication and initiating treatment and, if necessary, accompanying the patient to appropriate follow-up care. It will be probably not unknown to you that 10 years ago, an enormous step was taken in Belgium in the reform of our mental health care system. This reform affects the whole country and the entire sector, and not just only public hospitals. The vast majority of our hospitals are private, non-profit institutions. Private for-profit hospitals are not prohibited in Belgium. Historically, Belgium, and especially Flanders, had a very large number of psychiatric hospital beds with an asylum function rather than an approach aimed at recovery and reintegration into society. It was therefore decided to shift the existing resources for residential care to special care for persons with a serious psychiatric problem in mobile teams, both for crisis care and long-term follow-up. Shifting resources means that hospitals can decommission a number of hospital beds and still receive funding from the government as if they were occupied. The staff members released as a result of this operation become available to the mobile teams. At the same time, we provide another function for psychiatric hospitals or psychiatric departments of general hospitals in the context of crisis care and intensive psychiatric care. For these intensive units, extra staff and additional psychiatric time will be allocated. Their task is to support patients who are in a crisis situation and who cannot be adequately cared for by the mobile crisis team, and to initiate appropriate treatment. Although each of these forms of care should be aimed at recovery and reintegration into society, it is useful to have access to services specialized in rehabilitation that pay particularly attention to maintaining or acquiring a home, to keeping or finding employment, and to active participation in social life. This approach to the organization of mental health care can only be successful if all these actors work together in one network, developing a care circuit that works with a common care plan and, above all, that makes continuity of care as an absolute priority. Finally, I would like to refer to the importance we attach to participation of users and their families, both in the organization of care and in the provision of care itself. Right from the start of our reform, users and family have been an integral part of the organization that participates in policy making. They are also required to be part of the local network committees. In practice, we see that experts by experience are often involved in the mobile teams and effectively play a role in the care itself. Based on this experience, a working group of representatives of users and their family members was asked to formulate a proposal by the end of this year that may lead to the development of an official recommendation or guidelines on the use of experts by experience in healthcare. All the authorities competent for one of these aspects, and there are many of them in Belgium, have agreed to these principles. To be fair, I have to admit that a full implementation of this concept will take many more years, but we know how important it is to do this right, and that's what we are working for. Now, more than ever, the importance of good mental health has been made clear to the eyes of everybody. Now is the time for better investments in mental health all over Europe. Therefore, I thank you for your attention and I wish you a fruitful discussion on the future of mental health. Thank you very much.
Thank you, Paul, for setting out some of the ways that you have reorganized your system to make access to mental health care more available for people who really need it in this challenging time. And of course, this question of investing to improve access is the theme for World Mental Health Day today. And I'm delighted to introduce our next speaker, the Commissioner at European level with responsibility for tackling inequalities. And that's Helena Dalli. And of course, she'll be picking up on this question on access and equalities. Commissioner, the floor is yours.
Good morning, and thank you for inviting me to address this conference. Can you hear me? Can you hear me?
Yes, we can hear you. Not very loudly, but we can hear you.
Oh, okay. So we don't talk enough about mental health issues and psychosocial disabilities. We don't see these issues, which for some are invisible. They are often overlooked when we talk about health or when we talk about disability. This is why it is so important to come together and discuss and reflect on the question of mental health, especially now as we see the devastating effects that coronavirus self-isolation and social distancing requirements have on those with mental health problems or psychosocial disabilities. Let's therefore take this opportunity today to listen and to share, to find solutions and to act together. We know that many persons in the EU live with mental health issues. They face many challenges affecting their participation in society. There is a lack of understanding. Fear and prejudice prevent people from reaching out. But their solution should not limit their rights to participate. Their situation should not limit their rights to participate fully in society. There is a strong correlation between mental health and mental disabilities. The UN Convention on the Rights of Persons with Disabilities includes in its concept of disability persons with mental health impairments. The Convention refers to barriers that prevent full and effective participation in society on an equal basis with others. And it is these barriers that we need to tackle. There is EU legislation that protects persons with disabilities in employment. There is legislation that protects workers when it comes to their health at work. Extending protection to other areas of life beyond employment, such as education, health, or political participation, is a priority for the Commission and the EU. The obligation of reasonable accommodation in the workplace for persons with mental disabilities needs close, and dare I say, closer attention. And why is that? It is because ensuring accessibility goes beyond removing barriers in the physical environment. Persons with mental disabilities should have access to the labor market and be given the possibility to work like everybody else. Accessibility also implies improving access to information and communication so that everyone can understand, so that everyone is included. But accessibility also means removing and preventing attitudinal barriers, which, although invisible, can be the most difficult barriers to overcome. Coronavirus has catapulted us into a world of digitalized interactions and has restricted our social contact. It has created isolation and anxiety. It has thrown constant uncertainty into virtually every domain of our lives. These changes have had a detrimental impact on the mental health of many Europeans. The first ever European Mental Health Awareness Week in May this year was an important and timely milestone. It was an occasion to talk about the importance of mental health and how to cope and adapt during the coronavirus crisis. My congratulations to Mental Health Europe for the initiative, which the Commission was pleased to support. These changes and constraints have also had a major impact on people living in institutions. Estimates show that today we still have more than 1 million people with disabilities living in institutions in the EU. The transition to community-based living is a priority for the Commission, and it is a question of rights. No one should have to live in an institution. The European Structural and Investment Funds have an important role in supporting the transition from institutions to community-based living, and we must continue along this road. The next EU budget will also contribute to this transition. The need for a shift to a new community-based paradigm was evident during the recent distancing measures, where visits were banned and contact of people living in institutions was made even more difficult. Coronavirus came to our lives as a new infectious disease causing severe respiratory issues. But the long-term effects of measures to mitigate the pandemic have undoubtedly severe consequences on the mental health of many people. The Commission has put in place several measures in the health area to tackle the immediate impact of the pandemic. We have asked Member States to pay attention to persons in vulnerable situations and those with higher health risks, including those with mental health problems. But we also need to work on addressing the longer-term effect of the coronavirus pandemic. In that context, I mentioned the importance of social protection systems. Their organization and financing are the responsibility of each member state, but member states and the EU can do a lot together. Social protection and inclusion are at the core of the European Pillar of Social Rights. The Commission will present an action plan early next year to further implement all the principles of the pillar. There is also the European semester, an important guidance and coordination mechanism at EU level for each member state. It is an important vehicle for the implementation of the European Pillar of Social Rights. The European semester delivers yearly country-specific recommendations to encourage member states to adapt their policies and programs to tackle inequalities. These recommendations in the Commission's toolbox will drive the EU's recovery in the aftermath of the pandemic. To underpin the recovery, the Commission presented the Next Generation EU package, including the Recovery and Resilience Facility. This will help the EU emerge stronger and more resilient from the current crisis. It allows member states to invest in reforms which should also make our social protection systems more resilient. While we focus on recovery, we must also keep the broader picture in mind. I took good note from your submissions that more than 80 million people across the EU experience some type of mental health problem. Even though mental health is key for our well-being, the World Health Organization stresses that nearly two-thirds of persons concerned will not seek help. Many of them also experience poor physical health. It is striking to hear that persons with mental health problems have a much lower life expectancy compared with the general population. The difference is at least 10 years. This is why we need to invest in improving the response of our health and care systems and to ensure the availability of essential social support services. EU funds are available to support that goal and will also be available in the next EU multiannual financial framework. Our initiatives and financial support for education and employment provide an opportunity to take action to improve the situation of persons with psychosocial disabilities and mental health problems. The question of legal capacity is also central in this debate. The issues I have outlined do not only have an impact on individuals, on the individual's economic situation, but also on their fundamental rights, such as the right to vote. Legal capacity is also very much linked to the question of free and informed consent. This means we need to rethink certain decision-making regimes which are in place. It is reasonable that third parties can provide consent for treatment on behalf of the person concerned without that person's involvement or consent. This is why mental health friendly and disability inclusive policies across all sectors are necessary and important for the well-being of many millions of Europeans. We are keeping this in mind while working on the new and strengthened disability rights strategy. Our future strategy is to be unveiled in early 2021, and it is still premature to discuss details at this stage. But rest assured that it will include measures for the inclusion of people with mental health problems. We have undertaken broad stakeholders consultations. Many organizations, including Mental Health Europe, shared valuable input and highlighted their expectations. Our objective now is to collect complementary feedback and proposals from stakeholders on the future strategy. I thank you again for your contributions, which will help make the future strategy stronger. Our disability rights strategy will be a building block towards a more fair and equal union. I thank you.
Thank you very much, Commissioner. And it's very positive to hear a strong message of support for addressing issues of mental health, which for a very long time have tended to be the Cinderella issue in health, under-resourced, underfunded and overlooked. So wonderful to hear that you will focus on it in the new paper on disability rights early next year. So now we're going to move from the EU response to look at the European continent, and I'm delighted to introduce our next speaker, Mr. Hans Kluge, who is the Regional Director for Europe for the World Health Organization. Hans, the floor is yours.
Thank you, Tasmin, and good morning. Let me first clarify that I'm wearing the SDG 3 mask out of solidarity with the countries which are now having to implement much more strict COVID restrictions. Dear colleagues, dear friends, I would like to start by thanking Mental Health Europe for convening this fantastic meeting. This is perhaps one of the most crucial times in our recent history for such a forum, as we grapple with the profound impact of the COVID-19 pandemic. 2020 will be a year that we remember as one that shook the world and brought many countries to their knees. An unimaginable number of lives and livelihoods have been lost due to COVID-19. Families and communities have been forced apart, businesses bankrupted, and people deprived of opportunities that a year ago were taken for granted. However, we have a way forward to create important change. As Regional Director of WHO Europe, I am prioritizing efforts on mental health through initiatives in three main ways. First, addressing the stigma and misinformation that exacerbate suffering. 2, bringing mental health care to the community. And 3, reforming policy and increasing investment. To understand where we need to go, we must first understand where we have been. And that means examining the toll the pandemic has taken on the mental health and well-being of individuals. From anxieties around the virus transmission, the psychological impact of quarantine and self-isolation, to the effects of unemployment, financial worries and social exclusion, the mental health impact will be long-term and far-reaching. And it is very clear that although impacted differently, no demographic or age group has been spared. Elderly populations faced increased exposure to isolation, loneliness and social exclusion, so they could protect themselves physically. Other adults had to navigate daily uncertainty around employment, income and how to meet the needs of their families. Health workers, my heroes, carried an enormous mental health toll in the workplace and often without adequate support. Although children and adolescents can contract and transmit COVID-19, they have largely been spared from the direct health effects of the virus, with most cases of COVID-19 in these age groups being mild or asymptomatic. Despite this, they continue to be negatively impacted by mitigation measures that may inadvertently do more harm than good, such as school closures. Overall, the harmful effects of the pandemic have not been distributed equally, as the Commissioner was telling. The poor and vulnerable have been hit most severely, and often with the least access to the essential services they so fundamentally deserve. Services were disrupted as demand increased. During the acute phase of the pandemic, lockdown measures were implemented across the region, and resources were reallocated to deal with the virus. As with primary healthcare and treatment of non-communicable diseases, the mental health services were dramatically disrupted. Now that we are recovering and reassessing the health priorities, we must determine how to appropriately address the increased psychosocial needs of the population at a time when services have been so heavily disrupted. COVID-19 has revealed that when necessary, we can make enormous policy and societal shifts for the benefit of our populations. Health, including mental health, must become central to efforts to recover in the wake of the pandemic. With a growing acknowledgement of the importance of mental health, we need to adequately respond. Even before the challenging events of 2020, I had identified mental health as a core need and priority in Europe. Having worked as a doctor myself for Médecins Sans Frontières in the most difficult settings on earth, I saw firsthand the impact that inadequate services and deep stigma have on mental health. This became a catalyst for my work strengthening health systems for WHO. During my campaign for region director last year, I traveled to all 53 countries with the strong support of the Belgian government, meeting all ministers of health. Each visit brought mental health to the fore. There was a growing concern about the public health challenge of mental health, the impact of stigma and increasing inequalities. In response, I made mental health a key flagship in WHO Europe's vision for health in our region. The European Programme of Work 2020-25, United Action for Better Health. This European work plan was unanimously endorsed by over 53 member states with strong input from non-state actors, civil society at the regional committee held last month, during which there was frequent support for the mental health agenda. This agenda is now being operationalized through a mental health coalition. The coalition will exist under the auspices of Sustainable Development Goal Advocate, Her Majesty Queen Mathilde of Belgium. It will bring together member states, innovators and advocates, but most importantly, the service users, the people affected and providers. The coalition has three main goals. First, to address stigma and discrimination. Second, bring mental health care to the community. And third, reform policy and investment structures. As to addressing stigma, it is unacceptable that individuals with mental health conditions and their families are subject to stigma, discrimination, and victimization. The coalition will build on efforts to eliminate stigma and discrimination by engaging communities and increasing mental health literacy, including concerted efforts with the health workforce across the region. Bringing mental health care to the community, the opportunity to integrate health and well-being into all sectors means that new ways of working are progressing with speed. In Belgium, my own country, for instance, we met in July a woman whose care was revolutionized and much improved when mobile teams were deployed to provide at-home services. We have a growing evidence that multi-sectoral networks providing varied assistance at the community level can be a vital lifeline for individuals dealing with mental health challenges. The pandemic has demonstrated the true potential of digital mental health solutions, and this new frontier can help us better meet the needs of patients with pre-existing conditions and those with newly presenting mental health challenges. On reform policy and investment, in the wake of the pandemic, we can better understand the scale of the mental health toll and prioritize efforts to address its impact. There is a new sensitivity to and awareness of the importance of good mental health and the need to invest in the care that is informed by the strongest evidence. This renewed awareness provides a unique opportunity for greater investment in providing these services at the community level and initiatives that fight stigma and inform communities. I am confident that by coming together through united action for better health, we can truly make a difference. I invite Mental Health Europe, member states, the European Commission, members of the European Parliament and other partners represented here today to contribute to our efforts to advocate for mental health as part of the broader SDG health and well-being agenda. World Mental Health Day next week on October 10 is an important opportunity for us to reaffirm our commitments to reducing the suffering caused by poor mental health and the lack of services. This year's theme, Mental Health for All, Greater Investment, Greater Access, will echo our ongoing advocacy efforts to raise awareness, stimulate investment, and drive action for mental health promotion, protection, and care. WHO will for the first time ever be hosting a global online advocacy event on mental health. This event will include testimonies of people with lived experience and interventions from national and international leaders about why mental health must be prioritized. In the lead up to this event, I invite you to participate in WHO's social media campaign tied to the advocacy event, including sharing your own experiences and participating in live discussion. It's a great opportunity to amplify efforts to reduce stigma and increase community understanding. As we come to terms with the impact that COVID-19 has had on our lives, there is a great scope to better meet the varied health needs of our communities. The joint trauma of the pandemic provides us with an opportunity to reshape the way we care for each other and create a shared environment of health and well-being for economic development and social cohesion. Thank you and good luck to us all.
Thank you very much, Dr. Kluge. Very inspiring to hear that when you went to meet all the different countries, they identified mental health as an issue that needs to be really picked up on. And it's really exciting to hear that there'll be this global movement towards it. And we accept your challenge to participate in the social media campaign and to share stories. And it's so important that people's lived experience gets brought forward. The testimonies are used to shape services that really meet people's needs. So thank you very much to our keynote speakers. And we are now going to be moving to a panel discussion. And I'm delighted to be handing the floor over to Nigel Henderson, who is the Senior Policy Advisor for Mental Health Europe. And his panel is going to be looking at future policies and smart investments for mental health and the determinants and psychosocial disabilities. And I remind everyone that you can interact using Slido. You can send your questions and they will be part of what's put to the panel for them to answer. So over to you, Nigel. The panel is yours.
Thank you very much, Tamsin, and good morning to everyone. And hello from Scotland. I'm sitting here in Edinburgh, and it's always good to reach out and be connected across Europe. So before I move to the panel, I will be asking them to give a brief statement and to introduce themselves, to tell us a bit about their present work around mental health and what they think is at stake when it comes to the subject of mental health. So I'm going to just go around each of the panel members. I'm going to start with Katerina. And Katerina, if you could introduce yourself and just maybe give a brief statement along those lines. Thank you.
Yes, thank you very much, Nigel, and hello from lovely rainy Brussels. I hope that over there where the rest of you are, it's a bit more sunny than here, but nevertheless. My name is Katarina Ivankovic-Knežević. I'm a Director for Social Policy and Directorate General for Employment, Social Affairs and Inclusion. And within my portfolio, I have all the different social policy aspects, including inclusion and disability. And we do indeed plenty of actions when it comes to the different aspects relevant for health. I also have the social protection, so I have to deal with the other aspects that are, I think, extremely important when it comes to the health. Regarding the mental health, we have been quite active, as you know, in various aspects, promoting in increasing the visibility of mental health as one of the really important prerequisites for decent living of persons, not only their inclusion in the labor market, but also inclusion in the community. And I have to say, I was particularly looking forward when Dr. Kluge mentioned the bringing mental health to community as really one of the very important aspects that we have to pay attention to. And it is one of the reasons that while increasing the visibility of the mental health problems, and I would even dare to say the mental health solutions, we help people experiencing different mental health issues really to be fully included in the community. And I think if that could be one of the takeaway of today's discussion, I think it's very important. Later on, I will show you and I will let you know about different aspects that we do within the disability strategy and what we are planning for the new disability strategy, but also about our promotional campaign where we try to increase the visibility of different aspects, which are also very relevant for mental health.
Thank you, Katerina. That's a good introduction. Can I now pass to John Ryan?
Yes, good morning, everybody, and thank you for inviting me to contribute to the event this morning. I'm also very pleased that Commissioner Dalli and Hans Kluge were speaking before me because I think they very well set the stage. This panel focuses on addressing future policies and smart investments for mental health and its determinants. And I'm very happy to share some thoughts on that. But I'd also be happy to contribute maybe to the subsequent panel on implementation and achieving change. Because one of the key points which I attach a lot of importance to is helping member states to really change the situation on the ground. And we do that through implementing best practices, and I'd like to speak about that for a moment. We have a huge generation of best practices, both at national and at European Union level, and I think Tamsin gave us a very good example of how this works in the natural world earlier on. These practices are very often generated through investment either at the national or at the European level, and we have been very anxious here to try and make sure that these practices are actually used, because there's nothing worse, of course, than having libraries full of best practices which are never actually implemented or rolled out on the ground. So we set up a group with the member states, which is a steering group on prevention and promotion, and where the member states have the opportunity to say where they would like to work together, what are their priorities. And we then support the member states in identifying interesting best practices, for national or international implementation. Mental health was chosen as a priority topic, and we were able to include 3 calls in last year's work plan for the health programme. And this led to member states choosing 4 multinational best practices for implementation using the support of the health programme. One of them, for example, dealt with supportive housing for people with severe mental health problems, and another on a depression prevention programme. The other 2 practices on mental health systems reform and on suicide prevention will be rolled out through a joint action which we're organising with the member states, and which will include WHO Euro as a collaborating partner. And we'll be able to support this with an €8.5 million investment. So you can see these are concrete examples of where, first of all, the member states identify where they want to work together. We identify then where there might be interventions which might be evaluated, which have been evaluated and which are chosen for impact. And then we propose these to the member states who are interested, and we finance them. So that's a little bit the process we have here. One of the best practices implemented via the joint action concerns the mental health system reform in Belgium. And we heard earlier on about the reform of the health system in Belgium from the policy side. And, the help we've got from Belgium and from the colleagues in Belgium is really appreciated, because they've really been very open to sharing their experience with the partners in the other member states. On the issue of policy and smart investment, our work is carried out within the framework of the Sustainable Development Goals, and also the 9 voluntary global targets set by the World Health Organization. We are also working within the context of our public health treaty obligations to coordinate and support national policies. Now, in 2018, we published a major report on mental health. It's the State of Health report. I hope you have seen it. If not, I'll add a link to it in the chat box later on. And this is an interesting report because it shows the impact of mental health problems across the European Union. We're not in a game here. We're not comparing one disease with another, and one disease is more important than another. But I think very often the impact and burden of mental health is underestimated, because this report prepared by the OECD and the Health Observatory show that there is 1 in 6 citizens in Europe which are affected by mental health problems. And this is a huge impact, both in health terms and also in economic terms. It impacts our health systems, it impacts people's performance, people's life, quality of life. So there are many, many impacts of mental health which go beyond the health impacts. On the positive side, of course, investment in people's health is a way to ensure sustainable and sustainable growth. And therefore, investing in prevention, in maternal and infant health programs, and focusing on children and adolescents, interventions in the workplace, and prevention of suicide and self-harm. All of these are important things. Now, the European Commission has been working on mental health for 15 years now. I think we have a number of initiatives dating from a green paper in 2005, and then a whole series of pacts and joint actions, a European framework, and the EU Compass, of course, on mental health. I'm not going to have time to go into all of these, but the point I'm making is that we will need, I think, to focus also on new aspects. And I think what Commissioner Dalli said on the new policy papers which are being prepared at the Commission level, we'll also need to integrate the mental health aspects and the question of rights of mental health sufferers and patients in that approach. So those are my introductory words. I hope I haven't been too long, and I'd like to thank you again for having organised this important event, and I'm very, very committed to participating in this discussion.
Thank you very much, John. That's tremendous, a great run through there. And as you say, there have been a number of European initiatives around this area, and we'll maybe come back to some of that. Just in terms of continuing the introductions, can I ask Francesca Colombo from the OECD to maybe give us her introduction and what some of the work they're currently doing at OECD? Thank you.
Sure, thank you very much. Thank you for the opportunity to speak. I'm the head of the Health Division. I would like to make two main points. The first is why OECD is working on mental health. And the second is what we are doing. So going to the why, I think it's quite obvious, it was mentioned already in some of the interventions, but mental health have a significant, not just personal cost, not just the cost for the health systems, but also significant social and economic cost. And OECD is an economic organization. We particularly look at the aspects that relates to how to improve policies for better lives, but through the lens of economic analysis. And because of the very, very significant cost of mental health, even for the economy as a whole, we estimated in the Health at a Glance a couple of years ago, the flagship publication Health at a Glance, which is done together with the Commission, that the cost as a share of GDP can reach as much as 4% of GDP. And this is not just the cost of mental health treatments, but really the lost productivity, the presenteeism, and the consequences more broadly for society. So this high cost is the reason why we do it. I think the other reason is that even if there's been significant policy attention, which now is being given to mental health, there is still quite a lot of neglect. Spending on mental health has been increasing, but very, very, very slowly. Stigma is still there. There are lots of efforts that still need to be done. So in a way, we have not finished with the policy job of making sure that we address that significant issues. And thirdly, obviously, and again, from an economic perspective, there are high cost of mental health, but there are also significant payoff from good, positive mental health in terms of investments in mental health well-being, for societies, in terms of productivity, in terms of economic participation. So those are the reasons why OECD is really paying a lot of attention to this issue. And so concretely, what we are doing is not just in the health side, it's also other parts of OECD. From the health side, we received a mandate from OECD health ministers when they met in 2017. They met to talk, actually, to be quite frank, they met to talk about different issues. They talk about the high price of medicines, about how to reduce mental errors in clinical practice, to talk about workforce and support. And they said, why are we not talking about mental health? It's such an important issue. It's something in which not only we need to make more efforts, but we are also struggle to understand how we are doing. And so they gave us a mandate to better benchmark the performance of mental health system across countries. We are working on this with lots of difficulties because one of the issues that we found out is that there are very, very few data, few indicators, and benchmarking when you have very, very little to draw from is quite hard, but it shows an area where directions needs to continue to be. The other issues on which we are working in OECD, we have something called the Council Recommendation, OECD Council Recommendations on integrated mental health skills and work. This was something that was adopted by ministers of labor that highlighted the need to address mental health issues from an integrated policy perspective, cutting across also the education sector as well as the labor markets and health. And so we are working on seeing what countries are doing, what are the useful practices, but also are they making progress in towards those principles of good integrated mental health policies that they have agreed to. That was in 2015. So we are monitoring them, and although there is no legal obligation, it's a soft law, this council recommendation that we have at the OECD, there is a very, very strong effect by simply benchmarking how countries are making progress to make sure that that they can really keep and continue on making efforts. And the last things, it's more something which will come next. I mean, the work on mental health benchmarking that I talked to will be published end of this year or beginning of next year. There's other work that colleagues are doing on the mental health well-being, looking also at the positive mental health aspects. It's part of the house life work that OECD has been doing more broadly. So the whole, as much as we talk about a whole of government approach that is needed, the whole of OECD is also really mobilized to try to address the gaps and try to put this strongly on the policy agenda and make sure that there are real concrete changes that continue to be made. Thank you.
Thank you very much, Francesca, and some points that I'm sure we will come back to in the discussion. So, and our last and by no means least panelist who will introduce themselves is Maria Walsh, and Maria is a member of the European Parliament. So, Maria, would you like to give your introductory remarks, please?
Thanks, Nigel, and good morning, everybody. And as Katerina had said, yes, it is a rainy, overcast day in Brussels. But as an Irish woman, it's a pretty standard day when it comes to weather. But I'm conscious of time, Nigel, and I'm conscious me as a politician usually gives a long-winded intervention. So I'm going to keep this nice and short and sweet as my gift to you all on a Friday. And say, first and foremost, how delighted I am to be here in talking about and highlighting, and most importantly, learning about various aspects of our own mental health and of our citizens across the European Union. This is a topic that's very close to my heart on a personal level. Within a very, very short distance, maybe 10, 15 miles of where I grew up in a rural area in the west of Ireland, we've lost a number of community members of various ages, both genders, through mental health issues in their own careers. And with that, the supports really echoed in not just helping the person with mental health, but also family members and community members to try and rebuild their lives after a traumatic loss. For me, I'm relatively new to politics, but I'm not new to community activism. And it was apparent to me over my 2019 campaign to win a seat here in the European Parliament was that individuals, community groups, countries talk about great things like jobs, increasing employment, of course, our climate and how we need to support and do better, trade deals and how strong the currency is, and all of that is highly important. But I didn't hear a lot of conversation around the fact that if we have citizens who cannot step out of their house, step into the workplace, step into their community without feeling full support within the holistic self, so not just the physical health, but also their mental health, then we are doing a disservice as politicians, and as creating a stronger society to protect all and every community member, be it that they were born in the European Union or they've recently or call their home the European Union. For me, in terms of workflow, and I know we will be getting into it, Nigel, later on with the questions and answers, but one thing I definitely want to work to deliver, and again, events like this morning really help instill that drive to make it happen, would be a European Year of Good Mental Health, and that just echoes the importance that we have on mental health with our constituents. It allows for us to work with all member states on very grassroots programs that get into the communities, be it rural or urban, and support citizens and really lift the stigma of what mental health looks like. I sit on the Employment Committee here in the Parliament, and every file, every time I have an opportunity to talk in committee or at group level or in the plenary itself, I bring up the mental health, because the more and more we hear about mental health, the more that stigma lifts, I believe. I also submitted for approval a proposal for the first resolution on mental health in the context of COVID-19. And as many of the other speakers, and I know Commissioner Daly had mentioned, we are living in an unprecedented time. And while restrictions of our physical movement have been put in place in many countries, we forgot the key aspect of citizens. So those who feel mental health doesn't even belong within their conversation table are feeling the effects of mental health. And now is our time. We are at the crossroad to really impact change at every level. And I often, and I continue to do so, and I'll be doing it now, calling on the Commission and the Council to start working together with key stakeholders and the many on this call to really bring forth policy legislation supports, not just financial, to our citizens, and again in the most rural and urban areas, because what we learned from COVID, you can be in an apartment in a busy city, or you can be out in a isolated community, and mental health still affects each and every one of us. With that, I'll wrap up, and I hope I kept within my 2 or 3 minutes. If not, I'll apologise, and I really look forward to an engaging conversation. And thank you again for having me.
Thank you very much, Maria. And I wasn't counting actually in terms of the time. But I like that idea of a year of good mental health, because I think often campaigning years are based on what's wrong with the situation. And actually, it would be really nice to celebrate what is strong. So actually, what is it that gives us our good mental health? But I'd like to move on now and maybe just open up for discussion with the panel. So we've heard that that spending on mental health is not all it could be across Europe. We've heard that, and I think this is really interesting from Dr. Kluge, that 2/3 of people don't seek help for their mental health problems. And I can only imagine that if those people did seek help, could our systems actually cope? We have access issues anyway for the 1/3 of people who do seek help. We have issues around employment and unemployment for people who have long-lasting or severe mental health problems. We have housing issues for people with mental health problems. We have issues around legal reform and people's rights and the deinstitutionalization agenda. And I think the other one for me is the upsurge in the use of digital. And I know from my own work and my own experience that a number of people we work with who do experience long-term mental ill health feel digitally excluded. So what do we do to actually make sure in this digital age that actually people have access to the right equipment? So there are a lot of policy areas there and a lot of potential investments. And I wonder if any of you would like to comment on what you think are the key policy or policy areas and key policy investments that we should be looking for in the field of mental health. And perhaps some of the challenges or the barriers to that. I don't know if anyone wants to pick that up first. Yes, John.
Yeah, just a few remarks maybe. I think focusing, as I did earlier on best practices to be rolled out at national level through the health systems is certainly one aspect. But one thing I've learned over the years in working with public health is the importance of the NGO sector and also the sector of health professionals. And I think it's really important that the Commission uses its financial instruments and its political instruments to make sure that there's a voice for healthcare professionals and for patient groups and sufferers as part of a process, that we're not only having this dialogue with the member states, because really the reality check comes when you are speaking to the patients themselves or to their doctors. I have a very good memory of a process we launched a few years ago for rare diseases, which some of you may have heard about. We were very concerned with these large number of rare diseases, and there was very little information available on the number of sufferers and how they were being absorbed in the health systems. And we led the member states into a process where they each developed a national action plan. And to our horror, about 2 or 3 years later, we discovered that in about half of the member states, no additional resources had been allocated. So on paper, we had a beautiful system. We had a community EU action plan. We had 28 at the time national action plans, but half of those were empty. They look very nice on paper. So this engagement with the governments is very important because they're the ones who are steering the national systems. But then I think you also need to integrate a discussion in the governance. You need to integrate a discussion with patient groups and with health professionals who are always very anxious to help. So you don't have to force them into the discussion. They will be there and they'll help and they'll give good ideas. So that's my contribution at this stage, not maybe on the investment, but maybe on how to steer the investment.
And I think you make an important point there, and I'll come back to some of that. But maybe Francesca, I think you've got your hand up, so if you'd like to say something.
Yes, and of course, I mean, being an organization that loves data, I think there is a need to prioritize investments in measurement. And I'm not saying just because, that's what we do a lot, but because the state in which we are is very, very poor on being able to understand what happens to mental health services and the impacts that they have on the lives of people. And so when I was talking about this work on mental health benchmarking, we're trying to fill in some of the gaps. The first thing that we did in trying to say, okay, if we're talking about mental health, what is the consensus around what we should know about mental health? And there was extraordinary and very quickly consensus that arose around issues about, principles like people-centeredness of services, then continuity of care, regular measuring of unmet needs and measuring of outcomes. So it was very clear from the point of view of practitioners, of people with lived experiences, of policymakers, that those were the areas. When we then started looking at what measures or indicators or understanding we have of these issues, well, we have very, 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 very little. We know things like number of psychiatrists, but even on things like inputs, we don't know about other type of workers that are working in the mental health space. And critically, we lack any measures of patient-reported outcomes, which are fundamental for mental health conditions. Only 5 OECD countries have these measures collected. Only 2 of them are really doing that on a more regular basis. So there is a huge gap, which necessarily then has influence on our ability to step up in terms of resources which are devoted to it, in terms of understanding which policies work best and so forth. So I think that is definitely a huge priority for investment. Even if we talk about stigma, there are measures which and surveys which go out in terms of attitude, but very, very, very few countries measure how the attitudes towards mental health is changing over time. And I think we need to make much stronger investments in this field if we want to really then have, greater even financial investments that is going to mental health services.
Thank you. And I think for me, I think John mentioned policy development, and Francesca, you've mentioned that collection of data and thinking about outcomes from the person's point of view. I guess just reflecting on some of that, I think actually we're very good at policy, and we have some very good policies. I think one of the real struggles we have is making those policies a reality. So we can write all these wonderful materials. And it makes me reflect on what we mean by community, because I think for most of us, we tend to think of community as being a geographical area, somewhere where we live. But actually, we have a digital community, we have communities of interest, and I guess we're not always thinking about how we connect with these different communities. And I wonder if the traditional model of policy making, which is often very top-down, yes, there's a lot of consultation, but it then becomes a very top-down process. Here's what we're going to do at EU level, at government level, even local government level. But what is happening in communities, and how do we empower communities? And I think the mental health community have been calling for this for a long time, to be recognised, to be able to take it. So I don't know if there's any comments on that from anyone. Maria, yes, and then Katerina.
Yeah, and I'm delighted you presented it like that, because, and picking up from your previous question, there is an awful lot of work going on, as you say, across different sectors, but it's often almost quite splintered. Sorry, they've decided at the one time to do some work outside. Apologies about that. But it is quite splintered, and from a member state perspective, from an Irish perspective, I was doing so much research before my own election to see like what is actually happening at every level. And there's great work happening on one side of the country, and then great work happening on another, and then they're working with stakeholders across the European side. And then you're thinking, but who do we actually are landing with it? So in terms of employment, reactions and actions are coming in from the European Union, but yet are we actually, in terms of employment now, are we bringing it that, under the guidance of sick days, is mental health included within that? So our citizens can actually take time off should they need to. And it's not just a requirement of an immediate breakdown that forces them to leave the place of work. Hate speech, and you mentioned digitalization. We are the most technology advanced, we're living in the most technology interconnected world that I think any generation could ever be in. But yet, if you ask many, or you survey even 1,000 people across the European Union, I wouldn't be surprised to hear that they feel most disconnected. And then you move that into the hate speech world, which predominantly women and children are getting most of it. But do we have parameters that fix that? Or and again, the very essence of why this event today is so essential is education. Like, are we really understanding the very facets of it? How do we break the barriers? And I'm delighted Francesca highlighted the analytics side of it and the impact that work collectively. And again, puts back to my first point around fragmentation. And I don't know, does it work where you have everything feeding into one system? Probably not, because we have a lot of different perspectives and views. But the speed of coming from the European Parliament, when I pass something, say today, it goes into Commission Council in particular holds on to it, like the anti-discrimination bill, and then it takes member states up to 5 or 6 years to enact, maybe a bit less, if people are calling on it, and then it's so watered down by the time it gets to a constituent. Now, I know I'm paraphrasing for you and only giving you overviews, but I'd love to hear the thoughts of others. But I hear you on the urgency of getting from A to B, but we seem to get from A and then do a couple numbers and letters in between before we actually hit what the people that really need it, which is citizens on grassroots levels.
So we've reinvented the alphabet, it sounds. Katerina, I think you wanted to come in as well.
Yes. I wanted to come in on both questions. On your previous one about investments, and also on the second one relevant to the inclusion in the community and different aspects of the inclusion in the community. Well, if we really want to realistically think about health investments and investments in mental health, I think we have a possibility to do it and to do it quite quick. And I'll share with you that right now on the table, we have, I counted 1, 2, 3, 4, 5, at least 6 different instruments that we can support different activities in the member state. I have to say, having a background from as a member state policy maker, it is quite a big challenge and quite a big burden that has been put on the member states to choose what to finance and how to finance, because and I will focus only on the health aspects in this respect. We had the CRE and CRE Plus as like immediate reaction to the COVID crisis, where different medical needs were being met, but mostly in the light of COVID consequences. Now we have the new instrument called REACT-EU, which is additional money to financial period 2014-2020 with, I don't know, around 60 billion euro for different activities to be continued from this period, including also health investments. Then we have the new cohesion package with ESF Plus and BRDF, with also quite a large amount to be invested in health. And then we have the RRF with an amazing amount of funding, which is almost equal than the whole cohesion envelope, which is dedicated to finance reforms in the member states according to the CSR 2019-2020. If we take on board that in 2020 we have 27 CSRs relevant to health, and in 2019, we have, I think, I don't know, John, if you know it by heart, I think it's around 17 or 18 member states that we have put the CSRs in this respect. So we have all the prerequisites set in place for the member states to prioritize the investments in health and in health reforms. And I think it's extremely important because if we don't want to look at the crisis, but we have to look at the crisis, and we have to see how it affected people, how it affected in the light of, Nigel, as you mentioned, the DI agenda, so the whole processes. I think we could, if you want to discuss about the independent living and the fact that for some months, the activity is very relevant for community-based living, like a home care, which I don't mean home care like in institutional home care, but in the person's homes, was almost stopped, and people could not get such a help. But also the DI processes per se were in a way put on hold for a while. And I think we have a really good point to say that these are the topic that we want to see in the future programs, that we want to see member states addressing in the RRF national reforms and resilience programs. And also this is something that we as the EU should very much support and should very much push to have there. There are also different aspects of the mental health issues like loneliness. We still are looking forward to see if the EP is going to vote on the pilot project on the loneliness. And John and myself, we agree that it is a good project that we should keep try. Different elements relevant for children, and we see that digital exclusion of children living in poverty to access and to participate in the regular school system that was and that is still in place in various member states due, of course, to the COVID consequences is something that is creating a serious issue, and we are trying to find a way how to address it. the digital exclusion of the elderly, I think, is a topic per se. We could really invest lots of time and lots of energy in trying to see how to assess it. We have seen some good examples, like some homes for elderly who get their beneficiaries the tablets so they can communicate with the outside world, which was shown like the best measure to prevent their social isolation and their feeling of loneliness. And those simple, sometimes approaches that go below the radar, because we don't really see what is so relevant at the community level. I think this should be all the priority of future programs and of future funding. And I know I opened too many questions maybe for the moment, but I think it's at least relevant that we try to open them, and then of course all of us in our own little boxes and working together to try to find a solution. But it's very important to speak about it, because if striking 2/3 of people who do not seek the help, I think we need to ask ourselves, why is that so? And what is the reason, and then address the reason at the core.
Okay, thank you. And John, I think you wanted to comment as well on this. And then I'm going to move to some questions that we seem to be getting quite a lot of questions through from the audience. So I want to maybe pick up on some of that. So John, over to you.
Yes, I've got 4 points, and I'm going to be super, super quick, even quicker than Maria. So first of all, the EU doesn't have to be top down, it can be bottom up. 2 examples: the cancer screening recommendation, which was adopted by the Council of Ministers at a time when less than half member states had cancer screening for cervical or breast cancer. So this came from the cancer community pushing the agenda for cancer screening and setting an agenda at European Union level from the ground up. Second example, smoking prevention. When I started on tobacco control here in the Commission, I can tell you 99% of the member states didn't want to hear about it. It's the opposite now. 99% are on board and 1% maybe is against. So what I'm saying is that there can be a very, very good inspiration of policymakers providing a sticking plaster on the wound. You're not sorting out the origin of the wound. So I think it's really important that we, as Katrina was saying, how do we include the recommendations on the semester, for example? This is a good way of making sure that the actual systems are changed rather than just adding a sticking plaster. Third point on Corona. The major impact of Corona, besides the disease itself and the impact which we've already seen, which we're living through, is what's going to come. I think the economic impact of Corona will be enormous. Maybe our colleagues from OECD could say something on the subject, but what I'm afraid of is that the national budgets will not be able to afford what they used to pay for, let alone what we expect them to pay for in the future. So the sustainability of national health systems, I think, is very much being undermined by the current pandemic. And I think this is not properly measured or planned for at the moment. We can't imagine that the money is going to be more plentiful in the future after the pandemic than it was before. But maybe that's just an opinion at this stage. And the last point is on integrated care. I think one of the big unsolved problems is not only the health systems, but the link between the health systems and the social care systems. There's absolutely no point in bringing somebody into a healthcare setting for 3 weeks and then turning them out again and depending on another administration to come along and help them. So this is really a problem, and I'll stop there. Thank you.
Thank you, John. And I think that point you make about the socioeconomic consequences of corona, I have to say that my own experience is that I see some early signs that what little investment has been made in prevention and early intervention services for people with mental ill health are actually, that money's beginning to slip away because the need to meet urgent and unscheduled care is now becoming the priority again. And I think, we have a policy rhetoric that says prevention, early intervention is good, but actually the reality is that we often just deal with crisis and we're very reactive. But just moving on, sorry, I know I'm not a panelist and I shouldn't be having my own say, but anyway, hey-ho. A couple of questions. People are asking about what they call the investment gap. So we agree there is a need for investment in mental health and psychosocial support. Would anyone want to hazard a guess, and this is maybe a question for Francesca, would anyone want to hazard a guess at what that investment gap might actually look like?
Difficult. No, we have not looked at how big the investment gap might be, I'm afraid. So it's definitely there is an investment gap. Definitely we need to invest more. It will probably depends also on country-specific circumstances. There are very, very different levels of spending even across countries. So it's incredibly difficult to come up with a figure. It might be even misleading because some countries may need much, much, much more and others may need less. This is a point. I mean, it's probably, give me ideas. It could be something that could be worked on. I mean, there is definitely an issue in the current context. And I very much agree with what John was saying. I mean, we'll be facing very tight budgetary circumstances and very difficult circumstances. The impact of coronavirus on the economic growth and on GDP has already been significant. I think by the end of the year for the OECD area, it's going to be a reduction in 4.5% of GDP, but higher in some countries, less in others. And there's huge uncertainties for the future as well. So money will certainly be tighter. And I think the questions then will be where the investment should be best targeted. The roots certainly suggest that investments in the prevention aspects, that seems to be very much where the money is cut first. That's what happens during the previous economic crisis. The investment on prevention across the board was cut. I would say also in the integrated response, integrated policy approaches to address mental health and definitely, I mean, the frontline also workers, the service delivery, those should be probably priorities.
Thank you. Anyone else want to pick up on that one in terms of investment? Maria, I don't know whether you think there are powers within the European Parliament to point investment in that direction or to increase investment?
Yeah, I mean, to be honest with you, when it comes to mental health, I don't think no investment will be enough. The more money you can, any country, not just Ireland or any country across the European Union, but worldwide, can put into mental health supports, because as everybody has referenced, the increase of digitalization, the pressures of work seems to be increasing.
We seem to...
Have you got me now?
Yes, we've got you again. Thanks.
And I was just on a roll there. Apologies. But, down to the very simplistic ways one used to live and the implications of what 2020 looks like. This is even pre-COVID. I don't think we're enough. I'd be interested myself actually to figure out an investment gap, and perhaps whoever has asked that question, Nigel, you might happy to put my email into the chat box, and we have a wonderful research unit here in the Parliament that I can ask that question and see where it is. But when you look at the GDP and what's spent in reaction care of mental health, that gives you a pretty good indicator. I think it's about, and maybe John, I'm naming and shaming my other Irishman to help me out on this one. But for what it was, I remember last year was 4% GDP spent on reaction care. So when you think of that, then can you imagine what investment gap is within that to protect citizens? But in many ways, we've a lot of work to do. And of course, from the Parliament side, our job is to not just be legislators, but also put pressure on to ensure member states, our own ones and others, are working as quickly and diligently. I do want to just pick up on John's point, and it's true. I get a number of calls from constituency groups that have been approved for a pilot project. They run 3 years. It's very successful. They have to go on a hope and a prayer to get another 2 years or 3 years of investment just to continue on their work, and then fall short. So I believe it was Katarina had said, we have so many great programs. I think you'd said 6 different instruments. And then on the pilot projects, we have, probably thousands across the European Union that are doing tremendous work and then unfortunately fall short. So you might have someone who's using, particularly young people, might start using community mental health support services in their first year of high school. And then that program, by the time they leave high school, is finished, evaporated. But then they're still transitioning into other parts of life, be it their first job or their first third level experience, a relationship could break down, their own orientation, that conversation on LGBTQI rights. They might come from a new family that's coming in to the European Union, so might be under asylum status, and they still have a lot of work to do, and then you have a pilot project that just evaporates. Nigel, I've gone on another rant, so I'm going to mind my P's and Q's and just say anything, and I'll pop my email into the chat box. So if there is that specific question around investment, I'll certainly look into it. Thank you.
Okay, and we're running out of time now, but I think, John, you wanted to come in, and I also have a question, John, that's been asked specifically for you about whether there are any plans to update the current EU framework on mental health and well-being, given the new realities as the questioner has described it. So we can take your earlier point, John, but maybe also address that question as well.
Just one question on the investment gap. I think it's not just an investment gap per se, but it's also the inequalities gap, which is a concern. If you look at the link which I sent around there on the health information data, one of the worst elements that you'll see if you look at that is the huge divide between the member states. We're living in a very unequal Europe. Unequal for cancer, unequal for mental health, unequal for everything you might like to think of. You can look through the indicators there, it's unbelievable. You have 10 years difference sometimes in life expectancy between one member state and another. Now, of course, some of those reasons, the reasons for some of those differences are perfectly logical if you consider age gaps, for example. If you have a member state where the age level is higher than another, and no doubt Francesca could explain better than me. But the point is that there are these inequalities there, and I think I would be concerned that rather than making the gap bigger and making things better for those who are best off, we should also focus and see which are the interventions which we could target on those populations which are the worst off. That would really be important for, I think, having a more just approach to Europe. Secondly, on updating the framework, the Commission is very open to updating the framework, but I think the first step in any of this would be to evaluate where the old one has gone, because I just don't want to develop a new piece of paper before we see what the shortcomings of the former approach have been. So I have nothing against, as I say, developing a new framework, but let's see and have a collective reflection first on how the old one did,
And I think that point about inequalities is a very important one, and it could open up a whole other discussion. And I think that notion that we actually, I think in our haste to implement things, we sometimes take a very universal approach to a lot of things. And we know that in many cases simply increases the inequalities gap. And I absolutely agree with you that notion of having a targeted approach where we can make the most difference most effectively and most quickly would be the sort of mantra I would take. Just We have, I think, about 1 minute left. There was another question about about data and the fact that data measurement is inconsistent across Europe. We have different methodologies, we have different approaches. How do we know we're all counting or measuring the same things? But I can maybe ask Francesca, that might be your area in particular, but maybe just for each of you, literally 30 seconds sort of closing statements just on this subject, and maybe in closing saying, what is your one big wish? Okay, who wants to go first? Okay, Francesca.
Okay, well, as you call me on the data, it's just obviously, yes, there are comparability issues, and that's why we keep on working. That's why all of us who are here at the Commission, of course, the OECD, we're just keep on working on improving the comparability, the availability, the robustness, but also the relevance of the data. Do we collect the right data? I did mention we have data on inputs. We have very, very little on outcomes, and we need to fill that gap and keep on filling that gap. And again, we collaborate with the Commission on an initiative which is called Paris Initiative, the Patient Reported Indicators Survey initiative, where mental health is a special focus. In terms of priority for the future, besides obviously the filling in the data gap, understanding also what innovative ways, we talk about digital, perhaps not, we didn't go much into that, but innovative ways of delivering services. What are the best practices in there? Can we be future focused, on how really we can do back into the future? I think that definitely a priority, and the integrated service, integrated policy responses. I think it's fundamental also to address issues like stigma, which is a society-wide issue.
Okay, thank you. I think across Europe we have different time measurement as well, because that's probably more than 30 seconds. Katerina, do you want to go next? Sorry, Francesca.
Yes. I don't have this limit of 30 seconds really well designed in my head, I have to say. No, I just want to share one thing that I see in practice, and that I think it's very important that we have in mind when discussing the investment gap. And that is the following: the member states, when you look the national budgets, two biggest spendings are health and pensions. And health is probably the first, and pensions are the second. So what I see in communication with the member states, and I have 8 member states that I follow, is that all the health investments are still seen largely as health spendings. And maybe because of really lack of data, that we would show how the mental health spending is really a mental health investment. I think until we manage to switch this paradigm, we will be running in the circles, because indeed it will always be a huge burden. And where it needs to be implemented in the member states, in the local level, with the owners of hospitals, clinics, and whatever else. So I think there is a huge work for all of us, and especially the research community, to try to put together the longer term impact of mental health investments, that we can show, and we can clearly show, what does it mean in 5 years' time, or 6 years' time, or 10 years' time? How does it reflect to the pensions? How does it reflect on the pension gap, if we want to discuss about it? Because we can analyze from the beginning of employment throughout the labor market career of a person, and then how it reflects towards the pension gap. I think then maybe we could have a chance really of putting it more on the agenda. And I don't know, John, if you agree with my small observation, but I still see, and this is not only for the mental health, this is also for all the investment in services, and what we truly believe in EMPL, that distributional impact assessment should be something that everybody embrace and that everybody does. And I think this is extremely important for all of us, who are trying to fight for the social agenda to be really high on the agenda of different policies.
Okay, thank you very much. John, and then Maria, I'll come to you as well, just to finish off. And we are really up against the clock now, I'm afraid.
So I have just 3 words to inspire our listeners. First of all, respect. Secondly, stigma. And thirdly, rights. And I think we've been talking about investment, health systems, but it's a human problem. If we get rights for mental health sufferers, if we get something done about stigma, and if we ensure respect for people suffering from mental health, a lot of the problems we've been discussing will disappear. And that's what we should be talking about, I think, later on. So, thank you.
Thank you very much, John. Thank you. And Maria.
Yeah, and just to piggyback off John's fabulous words there, I agree. You asked in terms of 30 seconds of what utopia would look like within the mental health space. For me, it would be investment in proactive care, so supporting people through transition periods, particularly our younger generation. So when they hit 50, 60, 70 years of age, the understanding of their own mental health space is one of positivity, and we talk about good mental health then. And then finally, utopia for me is if any person, regardless of age, orientation, creed, color, can get out of bed in the morning, and if they don't feel 100% themselves mentally, physically, they have within a short space, be it online or physically within their community, they have somewhere to go, and they have immediate support versus long delays, lack of infrastructure, and just not the awareness of what's around them, and equally the awareness from political leaders, policy, creators that we're missing those that most need it. That's for me. Thank you.
Thank you all very much. I'm just going to give you a wee virtual round of applause there. And so thank you for your contributions. And we could probably have spent another hour or 2 hours with this conversation. And apologies to the organisers because we have overrun, but I think that was worth doing. So many thanks for your contributions. And back to Tamsin, I think, or Claudia, yes. I'm not sure. So thank you all.
Thank you, Nigel, for a fantastic panel. It was really interesting, really inspiring. When we asked people at the beginning, what do they want from today? They wanted ideas, they wanted inspiration, they wanted optimism, and they wanted to see focus. And I hope that many of you were magpies and picked up some bright and shiny ideas from that conversation. Now, we believe in walking the talk on mental health, which means after having sat down for a while, you need an opportunity to get up, move around, breathe, get some water, use the bathrooms. So we're now going to give you a 10-minute break. And when we come back, we'll have a second panel, which will be looking at how we can implement some of these ideas. So thank you for participating. All of your questions will be kept. Where possible, we'll share some useful resources with you, and they'll build into the advocacy work of Mental Health Europe. Thank you all for participating. Take a 10-minute break, look outside, breathe some fresh air, and see you in 10 minutes. Thank you. Hello, everybody, and welcome back. We're now going to be moving to the second panel. And the second panel this morning of our session is going to be looking at how to implement strategies and achieve change. The first session highlighted the huge impact of COVID on our societies, where mental health was already an area that was under-resourced and under-dealt with. And we heard about the political priorities put forward at WHO level and also at the European Union level. We heard about the different funds and the different mechanisms, the policy initiatives, and now we're going to be looking more practically at what can be implemented at different levels. And this next session is going to be chaired by Jan Pfeiffer, the Senior Policy Advisor for Mental Health Europe. I pass the floor to you, Jan.
Good morning, everybody. I think it was already mentioned that there is a lot of policies and papers, but the question is how the reality really change. The Mental Health Europe made the research mapping and understanding exclusion in Europe issue 2018, and it was really not so optimistic because the most of the countries still rely on the hospital institutional care, and very few countries really managed to have a robust community care and implementing the human rights of people with mental health problems. I'm privileged to welcome three panelists. Caroline Wiemens from Federal Republic Health Service in Belgium, from the team which is responsible for mental health care reform. Veronika Niemi, Director General, Ministry of Social Affairs and Health in Finland, and Martin Rogan, Mental Health Ireland Chief Executive Ireland. It means we have two persons from the governmental level, one person from NGO. I don't know if you want to, Caroline, Mikko and Martin, do you want to a little bit introduce yourself to tell a little bit more what you are doing? Caroline, are you on?
I'm on. Thank you for the introduction. And first of all, thank you for this international platform where we can steal ideas, as mentioned before, and also for the opportunity to share our experiences concerning the mental health care reforms in Belgium, but also in other EU member states, and to discuss the successes and difficulties to such a big and ambitious movement during this seminar. My name is indeed Caroline Weema, and I'm Assistant Federal Coordinator of the Mental Health Care Reforms in Belgium. So let me start mentioning that in 2020, Belgium celebrates its 10-year anniversary of the mental health care reforms in Belgium. So the reform initially started in 2010 as a response to the call for action of the World Health Organization to organize mental health according to a community-oriented model based on the needs of the population. So At that time, to be honest, Belgium had one of the highest percentages of psychiatric beds in Europe, even a global top 3 ranking, I think. So a real indication that Belgian mental health care was mainly based on a dated model of institutionalized and specialized care. So this important observation encouraged all levels of government in Belgium, and there are quite some governmental levels in Belgium, to combine forces and aim to restructure the mental health services into a network of care that can be addressed by every individual in Belgium who has a psychological vulnerability, and that can support every patient's need to recovery. So this required a profound integrated collaboration on the vertical governmental levels, as well as a horizontal integrated collaboration of all sectors in welfare and healthcare, general health, but also mental health, with the explicit participation of experts by experience. This is a very important pillar for us. So today we are busy for 10 years, but we are convinced that it is really a continuous pursuit to optimal mental health care, and therefore never finished. Myself, I worked on a regional basis in the beginning of the reform. I didn't work for the government yet at that point. I worked as the implementer in the region of Antwerp for the reform of adults. As today, since a couple of years, I am coordinating the reform for children and adolescents in the Flemish part and the Brussels part of Belgium for the federal government public health. Your mic is off, Jan. We can't hear you.
Yeah, can you hear me? Yeah. Thank you very much for your introduction. Wally, can you just introduce yourself a little bit?
Hello, everybody. Do you hear me well?
Yes, we hear you well.
Good. In fact, I may say good afternoon from Helsinki, since we are past the noon already here up to north. And it's a great pleasure to be with you this morning and during all these discussions, and those previous panel discussion was already giving a lot of inputs for us as well. I'm working currently as the Director General for a department called Communities and Capacities here at the Ministry of Social Affairs and Health. And that is kind of a combination of different tasks, starting from early childhood to elderly people, health promotion and prevention. And somehow all these groups are vulnerable groups we are dealing with in the society. And it's quite clear that we need a holistic approach in many of our policies which we are dealing with. Today, I guess I'm here primarily because Finnish government just in the spring this year released a new mental health strategy, which is in force until 2030, and we are just starting to implement it. On the other hand, I might also expect that Finland is quite well known that during our recent EU presidency, autumn 2019, we prepared and the Council adopted unanimously the conclusions on the economy of well-being, which is very relevant to aspects, for example, discussed during the previous panel session, the investment nature of the measures needed to improve mental health. In fact, in those Council conclusions, it is definitely stated that the Member States recommend the Commission to adopt a new EU mental health strategy, and we are keen to see what are the progress in this sector. As a background of why, for example, in Finland we have renewed our mental health strategy is, of course, the changing environment we are living in and working in. For example, the rapidly changing work-life, new forms of work, aging questions, we have more and more loneliness, and even such a thing like climate change will affect also mental health. For example, here up to north, when we have a dark winter, or our winters are becoming darker since we don't have not that much snow. And even I'm not a physician, but I could imagine that this will have also a direct impact on the mental well-being of citizens. So all these things we have to take into consideration. The topical issue is, of course, the COVID-19 pandemic and its effects. And we feel and we strongly push forward that in all resilience or in all recovery plans, we have to take mental health as a very important resilience factor on board. And it should be targeted when resources are now used for recovery and resilience plans. One important factor as well in the European level is the implementation strategies for European Pillar of Social Rights. We believe that that's one element we can also take mental health into consideration. And of course, the specific health program EU for Health, which should also target the health questions. I think this is a kind of introductory remarks I would like to say at this occasion. Thank you.
Thank you very much. Martin, you had a 2006, you have a vision for change, and just now you're sharing this vision. Can you tell us a little bit more about yourself, what you are working at this situation in Ireland?
And just to reorientate, you're back in morning time here in Dublin in Ireland, and it's quite sunny here today. So my name is Martin Rogan. I'm CEO with a national NGO called Mental Health Ireland, which is a large NGO, non-government organisation, working with volunteers, and our particular role is around promoting positive mental health and well-being and supporting people in recovery. Our organisation goes back to 1966, and the reason we mentioned that is because at that time, as Carolina said a moment ago, in Ireland, we actually held the world record for psychiatric hospitalisation. By about 1950 in Ireland, about 1% of our population, about 22,000 people, lived in what were then large, sometimes fairly bleak and cheerless places of large psychiatric hospitals. And with the arrival of new treatments, people began to move away from the old hospitals and live back in their communities, but their community weren't ready for that. So our organisation was established to support people on that journey, what we now describe as recovery, re-engaging with your community, getting re-enchanted with life, taking up educational opportunities. And the role of peers has been really, really important in this. But also improving public understanding and mental health literacy, and understanding in both the technical sense, but also the empathetic sense. And I think the kind of segregationist model that might have applied in the past, we've moved away from that. So like you've mentioned, Jan, and it's interesting, we were moving offices recently and I had to take out some old documents, and I discovered a certain continuity running across documents. There was in 1934, a group of staff from one of our older hospitals travelled around Europe, visited the Netherlands and Scotland and parts of England, and came back with some recommendations which seemed very familiar to me. And in 1966, these same recommendations found a way into a national policy. We saw them again in 1984, in 2006, and in June this year, the Irish government has published Sharing Division. And while that recurrence is validation, the question is, have we not achieved these? What one of our service user leaders has described as implementation deficit disorder. So I think, as Nigel mentioned earlier, we have some really well-crafted, well-understood, very accessible documents. The question is, can we get a pop-up version? Can we get a 3D version that that actually exists within the community. And we would see our role as an NGO as bringing a positive force about being a pragmatic partner to bring these concepts and ideas into reality. And in fairness, I think a lot of progress has been made, but there are certainly still some significant challenges out there. What's a little bit different about this policy than its predecessor really cast itself as a reform of a mental health service. And that was the parameter of its thinking. It addressed itself, it was written almost like Abraham Lincoln might say, for the professional, by the professional, to the professional. And these were the authors and the audience. And it was really about recasting existing resource and repurposing it in a more modern format. The subtext of this document is a mental health policy for everyone, and it's much more inclusive of other government departments, the individual, the family member, and in its construct, and it's very important from the outset, that it was absolutely co-produced. Instead of seeking submissions from the usual suspects, the group came together and had a series of town hall and listening meetings. Over 1,200 people attended. And some of the professional bodies, indeed some of the vested interests, were unhappy with this methodology. They felt they wanted to have private session and have preferential access. And some even threatened not to participate and to actually stifle the implementation. And thankfully, the authors withstood that type of pressure and said, we want to hear all voices equally, and they will all be measured. It's not about abandoning expertise, but it's about understanding where that expertise is taking us and what's the public mandate for this policy. So we're at an exciting time. One of the things we're a little bit cautious about when we see mental health policy being published in Ireland is the last 3 policies immediately heralded an extraordinary economic collapse. So if I was a stockbroker, I would keep an eye on the Irish government's plans to publish mental health policy. And when it's about to be published, you should sell your stocks and any property you have, because that's the high of the market. So this document was due to be launched in December, and there was some delays on that. And if it had come when it was due in December, it would have come immediately before COVID. Its predecessor was in 2006, before the last economic recession, and its predecessor in the mid-1980s, when we had a very difficult economic time as well. So certainly by 2030, when this is due to elapse, just be very careful of how the economy is performing.
Thank you very much. Listening to all of you, it was already mentioned a little bit, but I'm curious how you implement the idea "nothing about us without us." It means that how the users of the services can shape the policies and its implementation, if there is some kind of formal way, or how they can balance the opinion of professionals, which I think this is still quite an issue in many countries. That if you can just tell a little bit more about how you manage this, which I think it's really important in principle. Mentioned already, yeah. If you can be more specific.
Yeah, I think if we look at, say, the people who usually are power brokers and decision makers in service provision and indeed in policy, they often have a long gestation in terms of professional experience, research backgrounds, working with colleagues, tapping into international expertise. The approach we took in Ireland over about a 20-year period, and we were latecomers to this party, was to work directly with service users to build capacity. In terms of academic programs, introducing trialogue, where service users, family members, and professionals met as peers, and developed courses in our third level institutions, and a huge mobilization and a big investment in recovery colleges, in peer advocacy, and in professional roles. So when an individual who has self-experience and has recovered wants to contribute, they have a full professional and paid role. Over half of my staff are people with significant lived experience, and they are the most potent advocates and most effective speakers and the most empathetic. And they bring a reality check to all of their work as well. So there's an immediacy and an urgency there. So it's like you need to implement as if your life depends on it. And people say, my life does depend on it. My family's income depends on it. Our livelihood depends on it. And my quality of life and my community living depends on it. it's almost impossible to compete with that level of urgency, no matter how passionate or committed you might be.
Yeah. Okay. Can the others maybe comment, Caroline, if what in Belgium, how you, if there is something, yeah.
Well, the role of experts by experience is without any doubt a key role in the creation of the strategy and the design and implementation of the reforms in Belgium. As ambassadors for a decent user and family policy, their involvement and participation as an equal partner is not just a recommendation, but a necessity, and at all decision-making levels. They are an important, if not the most important, stakeholder and conversational partner in the development, implementation, evaluation, and adjustment of the mental health care reforms in Belgium. But for this, of course, we have to train, support, and coach them, their representatives, so they can enable effective participation. So the Belgian government invests in a global training plan to accompany the reform and the inherent change of culture that this movement brings. And the training program is also addressed to user and family representatives. In some modules, they are the trainee, and in other modules, they are the trainer, depending on the subject. So they are included in our reform, in our mental health care policy, as an equal partner besides the professional care providers.
Thank you. Yeah, that's great. I think this is a big change which we can see in the last decades. Most of the countries are really much more careful, also to prepare both sides. I think the users as well as the politicians and professionals. Mikko, can you also mention, because I think the Finland is really champion for a long time of involving users in all processes. Maybe if you like to mention a little bit.
Yes, thank you. You are very right. In Finland, we respect very much and we rely very much on NGOs in social and healthcare. In fact, we are financing at the level of 350 million euros per year. Normally, our organized NGOs in this field, so they play a very crucial role in providing, for example, mental health services and preventive issues. In connection with this new mental health strategy, we have launched an additional 60 million euros for NGOs and municipalities who are currently responsible for organizing services, healthcare services in Finland. So there is quite an amount of funding. But what we see as well as important, and when we developed our strategy, we of course work very closely with interest parties, stakeholders, and people who are experts by experience. And I think what was quite essential that we would develop our strategy not as a fixed set of measures, but kind of a more goal-oriented nature, which leaves then more room for each interested party to develop their own ways to reach these goals. So that gives a kind of a fruitful environment for new ideas and new developments in this field. And as I mentioned in my introductory remarks, I believe that what we are working is quite closely depending on what is happening in the environment, in the economy and in our environment. And that should also be reflected. So it's better not to have two fixed policy lines, but more kind of goals, which we then try to fix our operations on it. Thank you.
Yeah, I think that this is really important that you mentioned how the role of NGO is important in shaping and implementing the new vision and new services. And what do you think? What was the most important momentum in your countries, which decided that you go this way? What it was the politicians, or it was the public opinion. It was a scandal. I don't know. What do you think? What was the because it's also for those countries which are still like very much based on the institutional care as many of the new member states, maybe they could hear what was the real, from your point of view, what was the kicking the point?
In Finland, like in, for example, in Ireland, there has been for a long period of time been the mental health has been evaluated as a big question, and we have had strategies already decades ago. But for example, we had quite a successful suicide prevention program in the early 2000 century. But since then, mental health issues were a bit pushed away during maybe there could be some effect of the latest recession after the financial crisis. Money was not that much, and it was more important to get all care facilities in condition, build up new hospitals, etc. But now, a couple of years ago, time was right, and it was really realized that, for example, for working life, the costs of mental ill health was quite high. In fact, it has been counted that the absence from work costs 3.4 billion euros yearly in Finland. So there is quite much to gain if we can improve the mental health of working age people, kind of as an example. But this was realized both by trade unions, by employers, and also by politicians. And they saw that there is a lot to gain if we have effective measures to combat this issue.
Mm-hmm. Yeah. Martin, you want to say something, I think?
Yeah, I think there's, I wouldn't say there's been one singular catalyst, but a number of elements have come together. So in terms of the greater public understanding has been really important in this space. Some political movement, some legislative change, some technical expertise, and particularly the mobilization of people who use services and their family members in a more organized way has been really, really important. I think one of the things we've had to be a little bit cautious of, and it's certainly, I'd be curious to hear of our colleagues' view on this, but in working with people with lived experience, we need to be very careful that we don't try and domesticate that voice and bring it into a professional space.
Yeah.
There's a term sometimes used here of Schrodinger's service user. So are you a professional or are you a service user? Have you somehow surrendered to work alongside policy writers and professionals? And have you lost your credibility with people with lived experience? So it's something that we need to absolutely respect the expert by experience in terms of their wisdom and their unique viewpoints, and not try and draw that into the mix too closely. But I think certainly the other thing we've seen too is this is across the world through our colleagues in the International Initiative for Mental Health Leaders, I'm a board member there, is I think there's a lot more conversation about mental health, but it's a much more inclusive space, moving beyond what we would have traditionally understood as psychiatry. And that's to be welcomed, but we need to be careful that it's becoming amorphous. You know, there's no shape or boundary. And people are having an absolutely healthy life adjustment to a loss, a bereavement, an economic setback, a relationship breakup. The risk is that it's being drawn into a pathological model, and that's unhelpful. So I think while we welcomed a new conversation, and certainly it's a more hopeful conversation, and I think earlier a number of speakers referred to the whole area of investment in mental health. Investment will follow success, and we haven't always celebrated recovery or highlighted the impact and the availability of recovery. So the public have been a little bit skeptical about making further investment when they weren't sure were they getting a return on that, and were people actually taking up lives within their community, within education, and indeed within employment. So it's really important that we highlight our successes without airbrushing some of the significant challenges.
Yeah, and I like the point of the how to keep really balance between supporting users and family members, but on the other hand, not domestic their voice. Yeah, I think that this is important, really, and not easy. Caroline, do you want to also say something about how you see what really was the momentum which moved your country on? You said that it's already 10 years, but just it was the more politicians or button up.
Yes, as I said in my introduction, and I want to agree with Martin. I don't think it was a specific momentum as a catalyst for this reform, because we started in 2010, but we already had a joint declaration from all relevant politicians in 2002. So before we put the policy into action and really started implementing it, there were another 8 to 10 years. But I think the main thing was the observation that we had a dated model of mental health care organization, that we had institutionalized and specialized care and not a person-centered, community-oriented, recovery-based mental health care as the WHO and other international organizations were proclaiming. So we felt the urge, the need to start restructuring our mental health care providing system, and we did it in phases, and we are still adding different projects and different steps in the reform. And as I said before, it's really a continuous pursuit. So we started with reform for adults in 2010. Then we started for people with a psychological vulnerability who are in prisons in Belgium. We launched specific projects for their needs as well. In 2015, then we started the reform for children and adolescents, and from today and for the future, we are preparing to add the specific activities and interventions for the elderly people in Belgium. So it's really a global reform, and it takes time also to shift minds on every level in our society, not only the mental health care system, but also all other relevant societal domains. If you would like, I can give a brief overview of the latest milestones, how we strengthened our community care and improved the integration of care.
Yeah, well, we don't have too much time. We have 10 minutes, I believe so. But if you can really shortly, yeah.
Yeah, maybe I just highlight three important points. There are many more, but I think these are the basis, especially in the starting years. Our mental health care reform is based on a global and integrated approach. It's incorporating all relevant societal domains in one policy, and all actions have to be coordinated. Our policy is locally implemented. We also think this is very important to have a bottom-up movement. So we created regional networks around the mental health users and their families, enabling all resources to be used efficiently in line with the needs and with a recovery-oriented vision. So we have 20 networks for adults in Belgium, 11 for children and adolescents. And these networks include all individuals who have psychological vulnerability, as well as their natural and supportive context. And we aim to include mental health in all relevant societal policy domains, as there is childcare, education, youth, work, sports, culture, employment, social housing, justice. It's a very broad policy. So to strengthen leadership and governance, this also was a very important objective, as suggested by the WHO. The Belgian government is investing in a new sort of function we call the network coordinator, and the network coordinator is mandated by a steering committee of the regional network or the network committee, whatever you want to call it, to support and facilitate the development of the network and to put in practice the global and integrated policy as defined by the government. So the steering committee, this is very important, has a balanced composition with representatives from relevant policy domains domains such as general health, like general practitioners, pediatricians, emergency services, the welfare sector, but also the other societal domains as mentioned before. And so these regional network have care-related and organizational assignments to 5 types of mental health care activities, from prevention to specific residential facilities. And the most important thing we are trying to obtain in this reform is to differentiate and to filling in the gaps we had in mental health care. So I don't know if you know the pyramid of the WHO with generalistic primary care and then the specialized and hyper-specialized care in the top. Well, we observed in Belgium that most of our financial means, most of our care was highly specialized residential facilities. So with this reform, we are actually trying to reverse the pyramid by developing a more ambulatory, outreaching mobile care that is in the community around the person, working with all the different social domains that a patient, an individual with psychological vulnerability is passing through. And then I think about when you talk about children and adolescents education systems, but also employment, culture, associations where you fulfill your leisure time. Those kind of societal domains are very important conversational partners in our new policy.
Yeah, I think you nicely show how comprehensive it is and how leadership is important. I think there is several questions. One question is about differences between old and new member states, where, of course, the old member states have some kind of, as you mentioned, continuity of these processes, and in most new member states, reform even didn't start. Do you think that something like pan-European mental health strategy or policy or whatever will be useful, or it's just every country responsibility, or do you think that it should be some advocating for European some kind of guidelines, or what do you think?
I think, Jan, in terms of if and I think a number of speakers have said this already, there's no singular destination, but we have a good sense of what's on the horizon we want to move towards. And a bit like a sat-nav, your sat-nav, you wants to know your destination, but first of all, it wants to know where are you right now. So any good policy statement will be very honest and clear about saying, this is our starting position, these are our priorities, these are our partners, and equally, who will lead this and who will be accountable and responsible to drive it forward. So that's a really important message in any policy implementation. I think sometimes governments are a little bit afraid of the mental health conversation because of the prevalence challenge. It's getting bigger and wider. And I think there are many lessons we can learn from the COVID experience, that people begin to understand that your health is not a private solo experience, it's a pooled resource. And when we care for each other, we get the best outcomes. And mental health is the same. And I think we'll see a movement from prevention, promotion into public health, and indeed increasingly in conversations with urban design, how people live, humane habitats, and a place where we can thrive and go forward. And it means that people who have vulnerabilities are less likely to run into difficulties, and that we have services that can respond very, very quickly. So I think, as Caroline said, in terms of this investment at the top of the pyramid is really important. And I suppose it becomes a policy decision and a politically difficult decision in terms of the people who are funding this. Do they see a return for themselves in the immediate and short term? And that can be a real challenge in the reform space, because in most European countries, the political cycle is 3 to 4 years. And some of these initiatives take at least a decade, perhaps 2, to bear fruit and actually to realize their ambition. So that can lead to some impatience, frustration, and a loss of momentum. And that's something we really need to be careful of. And as leaders, we need to articulate our successes and then set out the next challenge that we embark on together. I think a pan-European approach can be really useful, so we can share our successes, and probably more learning, we can share our failures. There are lots of things that appear to be really good ideas in the laboratory, but we cannot recreate them in the real world without extraordinary and inspirational leaders. And we're not allowed to clone them just yet, so it's very difficult to replicate these successes in some instances. But I think there's definitely a platform there.
Yeah. Any other reaction on this pan-European?
May I add something from Finland?
Yeah.
Well, as I already mentioned, that we are very keen to see that at the European level we could develop a standalone mental health strategy for the EU, as the Council recommended last autumn. It was very, very pleased to listen to the presentations by two DGs from the Commission, both employment and health. There were a lot of good instruments already available which could be put together in one program. But in addition, we need also other people, other services to be involved to get a really holistic approach which mental health issues really need. We need collaboration between different policy areas like health, social protection, employment, gender equality, non-discrimination, competitiveness, environment, and education. So it's a whole of government approach, and the EU, the Commission, and with member states could really put this in a holistic way forward and give a real importance to this issue. So we are really advocating for a EU mental health strategy. Thank you.
Okay. Caroline, do you want to?
Yeah, I want to. I think that Martin already covered important elements. I think dialogue on every level is very important, also within the European community, to learn from one another, to inspire one another, because this is what we learned in Belgium. It asks some good debate and to get to make yourself clear why things are working, not working. This also was a very important exercise within our national policy. We had debates with all stakeholders on the field to discuss the strategy, the successes, the difficulties, and to take their feedback and considerations into account. So it's a bottom-up movement, but with the European community, we can exchange ideas, strategies, and inspire. Yeah.
I think it can be very encouraging for people working at a local level to meet with peers who can problem solve together, propose ideas, and even just to get the moral support associated with that. And I think the keeping it, a local urgency about our work is so important, because we're all at different starting positions and the needs are quite unique in different areas. We've again seen this with COVID. It's presented itself very differently in different communities. So I suppose in the mental health space, we have to avoid a dermatological approach. In dermatology, they say there's 8 conditions and 2 creams. I think we need to have a lot more than 2 creams, and we need to have an array of choices and tools that can be used in different contexts. And there's some really interesting initiatives coming out of Philadelphia and New York, like Thrive, where they partner with local educators, law enforcement, prison services, the whole spectrum of arts, civic life, etc. And there's many willing partners who want to be part of the mental health conversation while continuing to do their own work. And with small little bit of guidance and a bit of interchange, it's very important that we approach this in a learning stance from our own point of view, so that we avoid a segregationist approach. I'm very conscious that psychiatrists, before they were called psychiatrists, were called alienists, because the individual had become alienated and lost to their community. And we need to be very careful that our interventions don't compound that sense of alienation or to remove people from their natural habitat. So where we can treat people in their own space, at their own pace and at their own time, and where the decision-making stays with the individual and the responsibilities that go with that, we have much more successful outcomes.
Yeah, we are. Thank you very much. I think we are already running out of time, but just we started a little bit late. Maybe can I ask you, as the final question, do you have on mind at least one recommendation maybe for Mental Health Europe? What we could do to facilitate these processes as the one of the European-wide organization? Can you give us one recommendation or one idea what on that level we can do more for that the processes go on? Anything? Just do you have any ideas?
I think if you could create a conduit for a conversation in the first instance, and then select from the array of things that we know work in the wider healthcare environment. We know that about 14% of current activity is evidence-based. We also know that if we find a solution to depression, it'll take about 14 years for half of the population to get access to this new breakthrough therapy, understanding, treatment, etc. I'm a bit impatient. I don't have another 14 years left in my career. So I think if we could create a platform to accelerate some of these ideas, use one and see how successful we are at introducing that model into each of our own contexts, I think that could be a really powerful bond and really impactful.
Thanks. I think that's perfect. Caroline or Mikko, do you have any ideas? What some recommendation?
I would have one quite old recommendation, which Finland has also been advocating, and this is health in all policies. So to remind that most of the mental health is not done in health sector, it's done in all the other sectors, and we need to be active there as well. Thank you.
Okay, and to strengthen maybe the role of the mental health Europe in this field. And Caroline, do you have any recommendation for us? What do you think? What is missing, or what could be more strengths on the European level?
I think strengthening leadership, governance, making the responsibility for a decent, effective mental health care providing system, common, joint responsibility in the vision of mental health in all policies, public mental health. Everybody is responsible for the mental health of European citizens. It's not only the Minister of Public Health, it's all the other ministers of all the other public societal domains that have to accord to this person-centered, community-oriented and recovery-oriented vision in mental health care. So this will be very important.
Yeah. Thank you very much. I think this is a great, final conclusion. Yeah, that we need more sharing, platform, support the leadership, especially those countries where this process is only starting, and that I think that we can be more active. I think. Thank you very much. Thank you very much, all of you. I believe that we have to finish. Isn't it?
Yes. Thank you very much, Jan, for a fantastic panel. Very lively. I learned many new things in that, and it was very inspiring to hear from the three countries, from Belgium, from Ireland and Finland, how you transformed your approach to mental health away from institutions and towards more community-based activities. So I'm going to encourage you to be magpies, like I told you about at the beginning of the session, and take the good ideas that you find and use them. And a reminder that in the previous panel, John Ryan said, if we keep three things in mind, we know that we'll chart our way in the right direction. If we recognize the rights of individuals and their rights of access to good mental health and to have the services and the environment that allows them to thrive, we will tackle the stigma. And this will be a way of making sure that everyone is respected in the way that they move forward. So lots of key messages there. Thank you again to the panel. And I just want to thank the audience who's been so active on the Slido. Lots of good comments and questions. These will all be taken into account by Mental Health Europe, and we'll try and use these questions to move forward. I'd now like to pass the floor to another member of the European Parliament, to Alvina Alamezza, to give us her viewpoints. Alvina. Go ahead.
Thank you so much. And I hope you can hear me and I hope you can see me.
Yes, we can. Go ahead.
That's great. Okay, so I'm joining you from outside. We have a beautiful weather here in Finland, and as you can see, we have all these beautiful autumn colors and leaves here. And going to the forest is also one very nice mental health act we can make for ourselves. But thank you so much for this great event we have had today. I have actually found these speaking points you've had, all those ideas you've had, really interesting and also quite new. And the seminar was opened with the great words of Jan, and what he emphasized was that this coronavirus crisis has put a lot of strain on many people. And I got to think of that idea because sometimes it has been said that the corona crisis treats everyone equally, and the virus doesn't discriminate. And if you can have it even though in any kind of situation in life, and it's equal somehow. And I really strongly disagree with that. And this coronavirus has been especially hard for those people with mental health difficulties, as John said. And this kind of isolation, all those fears, all this financial burden that people have to go through at this time, it hits the mental health patients the worst. And I think that if we want to have a good welfare society, we have to take these into account. Also, if you didn't have any mental health issues before, this kind of situation can create a trauma. And this trauma, it can definitely have long-term consequences. So this we really must keep in mind, and I really thank you for the great words, Jan. Also, there were other excellent points. Commissioner Dalli emphasized that mental health is a human right. And I think that is a key starting point for us all, because we really have this kind of idea that if you break your leg or if you have a need for surgery, you can't get this in the healthcare system. But when we think about effective treatment to mental health disorders and issues, then suddenly health is not a human right anymore. And I definitely think that this is discrimination, and this is the thing that we should fix. Here in Finland, actually, we have found from many research studies that there are effective ways to treat mental health and to prevent the issues. Also, many of these ways have been examined today in the seminar. And for example, we had a study that proved that even 4 times of psychotherapy, like short-term discussion psychotherapy, decreased the depression symptoms by 50%. And this is a truly great result. And it shows us that there are many treatments to mental health issues, and all of those treatments are not medication. And I definitely think that it is the human right of the patient to get better treatment. And this treatment that has been scientifically proven efficient. So basically, we have been acting on this in Finland even lately, and this was also actually discussed in the panel, which was very nice to hear. And we are building now more easy access, low threshold services, and that is what I find really important. I'm also a city councillor in Helsinki, and we made an initiative, or I made an initiative that we should have these clinics for mental health, where you can just walk in and get treatment right away, and it's for free and very easy access service. And basically, what we found out is that these clinics have now opened. There are 2 clinics like this in Helsinki, and they have had great results because many people have got enough help just from a few visits, and they have been able to continue with their life happily. So I think that this is a great result. And also we have gotten many messages from people who have went for this clinic and seek help in the time of real crisis. And for example, going to the clinic has prevented them from committing suicide. And some people have sent their messages that because of this service, I am still alive. And for me, that is the best thing that we can hear. And that is what we should all aim for. And I'm really happy that all of those attendees here in this event are definitely working for that every day. And I think that is so good. And I think it's so important for human rights and for well-being of people on this planet. Also, for me, it's personally important because, as some of you know, I was in school as 15-year-old when we had a school shooting. And it was already 10 years ago. And at that point, when I was young, I got severe mental health issues after the shooting because I survived from it physically. My friend was shot to death, and I had a lot of grief. And even though I got out of the school physically, I didn't really get out of there mentally, and had a lot of issues with sleeping and had a lot of issues with well-being. And at that point, I really noticed that me and my friends, we would have needed better services. And I think that at this point, we should work that every young person, a child, has those good services and is not left alone and not left behind. Definitely, what I find also important during this event was that Commissioner Dalli said that mental health has to be a strong part of the disability strategy. And I definitely believe this myself. Even though we have the coronavirus situation, which is of course a big burden for the health sector in EU, I really think that we have to take care of mental health and also put more resources to mental health research, projects, and all this kind of work that Mental Health Europe does. And I find it truly significant. And as politicians, it's also our responsibility to carry this out. Some of my colleagues in the parliament sometimes have said a bit like, it's great that there are people and organizations working for mental health, but there is not really mental health problems in my country. And well, what I think is that, of course, we have a bit more mental health problems in Finland, and it's a dark country, and we have, yes, we have problems. But I think that every country in Europe has this issue. And this is really a mutual challenge. And John Ryan commented earlier that actually, if we manage to emphasize on mental health, if we put resources there, it will basically pay itself back. And it's really smart, not only because of human rights, but also of economy, because 4% of GDP is annually spent on mental health issues untreated. And I definitely think that this is a number we should look into when we think about responsible economy and when we think about how to build Europe better. This is a number that we cannot ignore. And neither can we ignore those people who are affected all the time, or those people who would just be benefiting from more positive attitude towards mental health. And as today was discussed, mental health is not only about suicide prevention or treating depression, but it's also about green areas, housing, city planning, income, basic income, all these kind of things. So yes, I think that you have done such a great day today. You have inspired everybody with your speeches. And I definitely thank Mental Health Europe for organizing this and all the other great events. Because when I attend these events, I always learn something new. And I hope we have all learned something new today from all these great speakers at the panels and in the keynote. So for me, I thank you all for organizing and joining this event. And I really hope we can stay in touch and have the good energy to work for this very important issue. Thank you so much.
Thank you very much, Arvina. And also thank you for giving us a wonderful view of the Finnish landscape behind you, the lovely blue sky and green. We miss that so much working indoors, and our minds crave that for our own well-being. So we asked you at the beginning of the session, how are you doing? And I'm going to ask you again, how are you feeling now? Because we asked you also what you expected from today, and people were looking for inspiration. They were looking for ideas to feel optimistic, to feel engaged. So let's see how we're feeling. We're going to put up the poll again on your screens and let us know in one word how you're feeling now. We're checking in with you again on World Mental Health Day to see how you all doing. Okay, somebody said motivated. That's excellent. We hope to make you feel inspired and that you shared lots of ideas with each other. The idea is that you will be able to hear what's going on in other parts of Europe and to gain a sense of connection. We've got somebody who's feeling inspired, motivated. That's fantastic. Please feel free to share with you how you're feeling right now. At the beginning of the day, there were people who were feeling tired, who were feeling a bit slow, and here we are after a couple of hours of sharing ideas and visions. I know it's a challenge because it's so important for our well-being to be connected and have social contact. And in these COVID environment, when everything is done online, it's sometimes hard to create that sensation of community and connectedness. And I hope in the way we organized today, you had a chance to hear about that and how loneliness is being picked up as a key issue within mental health that needs to be addressed. So here we've got lovely messages, people feeling hungry, lunch is coming, I promise, reassured, connected, enjoyable, feeling empowered. This is exactly what we were hoping people would feel at the end of it. And it's why it's so worth putting the focus on mental health. So I'll leave this up on screen as people share what they're feeling. And I'm going to hand over to the Director of Mental Health Europe for our closing words on the session. Thank you all for participating. And I can see that you've got lots of messages around motivated, happy to be European, really enjoyable, optimistic. So I think this seminar really was worth organizing. Claudia, let me pass the floor to you now.
Thank you. Thanks. And this morning has been extremely interesting, but also I am aware long. So I really won't keep you much longer. I just wanted to thank all our speakers for their inspiring input. Our host, the Federal Public Service for Health, our moderators, our team, who has been really active and working behind the scenes, our audience, and of course also our facilitator for the day, Tamsin Rose. My really closing sentence is, it is clear that now it is the time to act for mental health recovery and rights for all. We do have the tools, so let's now steer the political and economic wheel. Thank you, everybody.